Hi, I'm Dr. John Chessare, the President and CEO of the GBMC healthcare system, and I'm here to give you our bi-weekly update on the coronavirus pandemic in the U.S., around the world, in Maryland, and also here at GBMC. So in the U.S., the news is generally very good. Rates of infection are down. The number of new cases are generally down. The number of people sick enough to be in the hospital, generally down. In Maryland, we are now at the lowest number of hospitalized people with COVID-19 that we've been at since October, the last time we were at a low point. At GBMC right now, there are 10 people who are COVID-19 positive. Only 2 of those are in the intensive care unit, and only 1 is requiring mechanical ventilation. So things are generally good. The positivity rate for those being tested is now below 2%. Now, this very low rate of test positivity makes it easier for us to do contact tracing. But before, when we were doing contact tracing, before we had the vaccine, the only rational step to stop the infection was to tell people to quarantine. And that was the job of the contact tracers. Now the situation is totally different. When we find a new positive test, yes, we want to find out perhaps where did the infection come from, but we're even more interested in finding out who that person may come in contact with, especially close family members, has not been vaccinated. And our zeal is to try to get the remaining people of the state of Maryland vaccinated. You have seen the governor and most jurisdictions significantly reduce restrictions. We can now go back to the stadium. We can now go to most restaurants and have full or close to full capacity. There are still more restrictions within the city of Baltimore, in large part because the vaccination rates are not yet where they are in the rest of the state. We have to remind ourselves that the reason why all of this is happening is because people have gotten vaccinated. So in order to keep ourselves safe and to not have another recurrence of the disease, perhaps because of new strains coming out, we need to get the rest of the people vaccinated. So thank you so much for your help. If you haven't been vaccinated and you still have questions, you may want to go to the CDC website. You may want to have a consultation with your physician. You may want to ask someone in the know so you can get your questions answered and get vaccinated. If you know of somebody who hasn't been vaccinated, be gentle with them. Draw them out into a conversation. Find out what they're really fearful about, and then try to help them get answers so that they too may change their mind and decide to get vaccinated, because that is the way totally to end the pandemic. Now, influenza season is almost upon us. In the fall, we will begin immunizing people against influenza. And we may want to remind ourselves that in the year just past, we saw almost 0 cases of influenza. Why is that? Well, it's because we've been washing our hands, maintaining social distance, and wearing masks. We've discussed before the fact that prior to the pandemic, there wasn't a lot of evidence out there about the value of wearing masks. Now the evidence is clear. Masks prevent the spread of viral respiratory tract disease. So you may want to wear a mask in cold virus season, even if you have been immunized against coronavirus. Masks are effective. And we will begin asking people to wear masks when they have a significant cold, especially if they're going to come into the hospital or in contact with people who have reduced immunity because they have chronic disease or some significant illness. So let me applaud all of you for your great work in getting us to this point. Your efforts in washing your hands, maintaining social distance, wearing your mask, and yes, getting your vaccine have paid off. We are almost out of this. But let's heed what we have learned as we move forward to reduce the risk that we have another pandemic, or that this pandemic doesn't totally end, or that we spread any viral respiratory tract illness. A shout out, as usual, to healthcare workers everywhere, not only at GBMC, but everywhere, who have done an outstanding job standing up to the pandemic and still are standing up to the pandemic. And again, let me tell you that if you need help, if you need care, we are here for you at GBMC. Thank you very much. Stay safe and stay healthy.